Well, after 13 months of study, the government's Organ Transplantation Task Force today unveiled a list of recommendations to ensure the state's organ transplant system continues to run smoothly. Lis Daily is in the Channel 8 newsroom to tell us that Indiana scores some pretty high marks in its organ procurement program. That's good news, Liz.
Sure is, Debbie. And Mike, the task force headed by State Health Commissioner Woodrow has found that unlike other states, Indiana has a program that is fair and efficient when it comes to providing patients with donated organs. But there's always room for improvement.
We found that the patients in this state are in very good hands.
With that, the task force handed over its 155-page report to the governor outlining suggestions for new policies as it pertains to organ transplants and organ donations. First, the State Board of Health will be responsible for coordinating public, private, and professional education.
One of the findings was that we needed to increase the educational information available to both the public and the professionals to make sure that they understood how important these programs were to them.
It also found that the organ procurement program, now being handled under an agreement between IU Medical Center and Methodist Hospital, is a workable system.
Given a year or two to work, if there are any adjustments that need to be made at that point, as we review the activities, we would certainly not hesitate to make those suggestions.
And the task force is suggesting plans to improve the driver's license donor information system so that all Hoosiers will participate.
We have to have a system which recovers as many organs as possible and shares them on an equitable basis and operates at the highest level of quality and cost efficiency.
The governor will review the 155-page report and respond to it as soon as possible. Mike, Debbie?
Yeah, Liz, what role will the State Board of Health have in all of this?
Well, it will monitor the program to make sure it runs effectively and that it doesn't turn into a program that discriminates against those patients who cannot pay for surgery. In fact, the task force recommended that a temporary fund be set up for those not covered by insurance.
Okay, Liz, thank you very much. Liz
Thanks,
Daily
Liz.
in our newsroom.